doing? My name is Deepina. Welcome back to my channel. Hope you all are doing well. Today's video is special. In fact, this month is special. Well, to begin with, in the year 2017, in the month of September, on the 12th to be very exact, I started my dialysis. How I had to start my dialysis is a different story for later. Today I'm going to tell you about my disease and a little bit about chronic kidney diseases in general. So, chronic kidney disease is basically renal failure. There are various stages of chronic kidney diseases. There are basically 5 stages. The fifth stage means renal failure, complete renal failure, which means dialysis. There are a lot of patients throughout the world who are in probably their second or third stage where they don't need dialysis, but they have to go through a lot of restrictions and be on high water intake so that the kidneys keep functioning. What does high water intake mean? High water intake means your kidneys have to keep running, they have to be active all the time so that they are working. In my case, the kidneys have completely stopped working, and that is why I have to take dialysis. Dialysis is a process where a machine through a dialyzer is a tube. That tube is that tube is what does a job. The tube helps in clearing the toxins, removing the water, and making your body toxin free. So, dialysis happens for 4 hours. It's basically a 4-hour long process. Now, to begin with, I have a disease called IgA nephropathy. It's an autoimmune disorder. Autoimmune disorder means there's some problem with your immune system. Okay. In my case, my immune system is overactive. Overactive in the sense my body fights its own organs. Okay. So that is what's happening in my body. There was a solution for my problem, which was a transplant, but later on we realized that transplant is never going to work in my situation. The problem, the autoimmune disorder that I have, transplant would just be a temporary solution for maybe just a little while. For me, it only lasted 6 months. It was very hard. I had to go through a lot of pain during those 6 months, but in the end, I decided to back off and lead my life doing dialysis. I'll tell you all about that later. I want to begin with how I really got diagnosed and how it all really happened. Well, in 2016, when I stepped into 11th grade, it was all going okay, but then later on I had a lot of issues and I got into depression. I got into severe depression. I was also seeing a therapist, but that didn't work out for me as much. So what happened was, in the beginning of 2017, in okay, so in the year 2016 I got typhoid twice. I had, and the third time it wasn't that serious, but the first 2 times it was really serious. I had to go through a lot of antibiotics and stuff. I was very fragile. Then all this happened, and I had really lost my immunity. I had lost the strength. Then in 2017, in the beginning of the year, I was having an issue with my eye. So I asked my mother to take me to an eye doctor, and I went to an eye doctor. After going to the eye doctor, I was told that there's no such serious issue with my eyes. I just have to get some few drops and wear spectacles. But then he pointed out to me saying that I think you have thyroid. Do you know you have thyroid? I said, no, I don't have thyroid. So he asked me to check it out. He asked me to go check it out. And I did go and get some tests done. In fact, I was diagnosed with thyroid, but not the normal thyroid. It's called the thyroid that I have. It's called Hashimoto thyroiditis. Hashimoto thyroiditis is basically a type of thyroid that comes into your body, that grows in your body when there's an external problem happening inside. There's an external issue, external internal issue. So for the Hashimoto thyroiditis, I consulted a general surgeon. The general surgeon asked me to get some tests done. I had to go through a lot of tests: blood tests, urine tests, ECG, then ultrasound, X-rays, and all that. I had to go through them, and then in my reports, the doctor found that I was losing protein through my urine. This happened when I had got typhoid in the year 2016. I actually found protein in my urine, but the doctor I was consulting said that there was nothing to worry about, and he gave me some medications for the time being. Said that if you take those medications, you'll be fine. And we did that. But later the next year, when we got these tests done as per told by the general surgeon, the the results were really bad. I was losing a lot of protein through my urine. So my general surgeon asked me to consult a nephrologist. I went to a nephrologist. I got some pretty serious tests done, urine tests and everything, and I had to start monitoring my protein loss. Initially, I was given some medication so that we could see if it was working or not. If I was, if the protein output was getting lesser. But then as I was taking the medication in the beginning, the results were quite good, but then later they started deteriorating. So then my doctor told me to get a biopsy done. The biopsy was a very painful procedure, very, very painful. What is a biopsy? A biopsy is basically the doctor taking out a tissue of your organ, cells, tissues, so that they can, check it under a microscope and see what's wrong with it, what's going wrong inside the organ. So after doing the biopsy, we realized that I had IgA nephropathy. The doctor had already told me what was going to happen. He told me the course of the the diagnosis. He told me that initially you'll be put on steroids. After steroids, we'll see if there's any positive reaction to it, if there was any positive outcome. But unfortunately, after I was started on steroids, I expanded and became an elephant. My legs got swollen, they were filled with water, like they became this thick. And then my skin tore like really bad. I still have those marks on my body. It's called striae. The tear is so, you know it's so the tear is so, what do I say, what's the right word, it was so harsh that you could see the blood flowing in your body. In the initial days when there was a tear in your body, basically at that time I was quite thin. I was like a normal person, and then I had gained around 10 to 20 kgs in a week. And I used to be really hungry, like so hungry. And trust me, those days I can never forget when, to satisfy my hunger, I used to watch ASMR videos on YouTube. And I had already started on a diet. I was kept on a diet, a very restrictive renal diet, where out of 100 things, 99 things are not allowed. Renal diet is the worst. And water intake is very, very less. It depends on how much urine output you're having. Initially, there was a good amount of urine output for me, but then it started reducing, and so the water got stored in my body. The water stored so bad at one point, I wasn't able to move. I wasn't able to stand, and that is when I was, taken to the hospital, and the doctor told me to my face that the steroids aren't working, so we are gonna put you on immunosuppressants. Immunosuppressants are like the highest form of medicines where they are given to you at that situation when we know for sure that there is no other medication that is going to work for you, that's going to salvage your organ. And they told me that there are a lot of consequences also. You'll be losing a lot of things. Like, I had to, like, my fertility rates and everything will go down. I can never ever become pregnant and all that. So I was put on immunosuppressants, and on the day 5 of my immunosuppressant course, I was admitted in a hospital, and I got a I got a seizure, a real bad seizure, and I had passed out. I had passed out for a few hours, and then I was very dizzy. I was coming back. My consciousness was coming back, and then I was again dozing off. It was such a hard time for me. Trust me, it was so hard. And upon, above that, they had to and insert a urinary catheter. That's the worst thing in the world. Trust me, urinary catheters are the worst. And I couldn't move, I couldn't brush my teeth, I couldn't eat. I was just lying on the bed, and they had to start my dialysis ASAP. And I was put on dialysis, and I remember shouting, please, please remove me of the dialysis. I don't want to take dialysis. It's really painful. And the nurse was talking back to me, and she was saying, like, a few more minutes, dear, a few more minutes, and you'll be done. Be patient. It's going to be over soon. And it was so painful. I remember the entire thing. I know it's all a little hazy, but I still remember it. Maybe because a part of me wants to remember everything that I've gone through. Trust me, starting at this position in my life, I think I remember each and every day of the past 4 years that I've gone through. I've gone through so much. I can't tell you in words about the things I've gone through. I really hope nobody has to go through all that. It's so, so painful. It's overwhelming. And at this point in your life, you think everything is over for you. You lose all hope. You think there's nothing left in your life that is worth living for. But trust me, at this point in my life, today, I can say that there is so much in my life that I'm grateful for, that I'm thankful for. And that is how I started my dialysis. I had a seizure, and I had my urea levels, uric acid levels, everything went up. My creatinine was really high, potassium, sodium, everything was extremely high, and so I had to be put on dialysis. I had to go through dialysis, and trust me, dialysis is a very, very difficult procedure. It's a very painful procedure, but trust me, after you're done with the dialysis, you feel so good. You feel so light. You feel so much better. In fact, what happened? Yesterday, I had dialysis scheduled as per my schedule, and I went to dialysis. I came back. I had a lot of water, but and today morning when I woke up, I was feeling a heaviness in my chest, and I got really scared. So I told my mom that, Mom, I'm gonna go to dialysis again. I'll take it for another 2.5 hours. So I went to dialysis, I got the dialysis done, and the chest pain is a little bit less now, but I'm feeling a lot better, but it's still there. You know, in the beginning, in the initial days of my dialysis, I used to vomit. My BP used to go down. I used to, you know, have rigor. Rigor is basically severe shivering. Yeah, and a lot more complications. These happen in the initial days. I remember my first dialysis in a proper hospital after I was discharged from the hospital after that episode of the seizure. When I was finally discharged, and the doctor told me that now your life is gonna have dialysis in it every day, so find a good hospital and make a schedule for yourself. You have to take dialysis 3 times a week. So on the first time when I took dialysis in a proper hospital, when they started the dialysis, there was so much fluid in my body that I couldn't breathe. I was literally, having difficulty breathing. They had to put on an oxygen mask and everything. My saturation levels went down. It was such a horrible, feeling. Not able to breathe. I'm telling you, it's like it's equal to hell. These are the little, memories I have of dialysis. I've never forgotten anything. I think now it's been more than 4 years and I've gotten used to it. This is my routine now. And what I want to say to you is that my life is this way, where I have to be dependent on an external machine to be alive, to be okay. And honestly, standing here today, I'm grateful for everything in my life. So please, no matter how your life is, I know everybody has stress in their life. There's so much stress, there's so much pain. But you can overcome each and every one of them if you really want to. You really have to want to do that. If you feel that, you know, if you know your problem, you know that there's so much stress in my life, there's so much pain in my life, there's so much problems in my life, but if you're not working towards it, there's no use. There is absolutely no use. You have to work towards your problem. You have to try to solve the problems and the things that you think are bothering you. You have to be grateful for whatever you have. You have to be grateful for the life you've got. You have to be grateful for everything that's around you. Be grateful for the absolutely amazing body and health you've got. Take care of it. Take care of your mental state. Take care. It's so important. Everything will feel fine one day. There is so much problems in this world. Everybody goes through so much. But you should know that people going through cancer, people having kidney diseases, going through dialysis and all are trying to lead their best life. When a person with so much limitations is trying to be happy, that means there is something about this life that's a lot more precious and that's worth it. So please take care of yourself, take care of everything that's going on in your life. Be happy, find ways to be happy, do things that make you happy, be kind. That is what matters. Everything is going to be all right. I hope you enjoyed today's video. I'll be telling you a lot of stories in the future about my disease. So stay tuned. Please like, share, subscribe, and hit the notification bell. Bye.